start? Okay. Hi, my name is McKenna Johnson. Did you know that between 2013 and 2015, 54.4 million people were diagnosed with arthritis in the United States? Out of those 54.4 million people, 7.5 million were diagnosed with a disease called psoriasis. Psoriasis is a disease that is preemptory to psoriatic arthritis, which is what I will be speaking about today. I will be discussing with you the causes, symptoms, and treatments. Psoriasis is a skin condition and is one of the most known common causes for psoriatic arthritis. Psoriasis develops or allows for the development of red, flaky patches along a person's skin and has been shown by the CDC to have 42% of people that are diagnosed develop psoriatic arthritis later in their life. People normally are diagnosed with psoriasis before they contract psoriatic arthritis, and according to Mayo Clinic, there are a few common symptoms that people experience, as we will discuss now that we have gone over the main cause of psoriatic arthritis. Some of the common causes include swollen, painful joints, nail pitting or even loss of a nail, and joint function loss or even permanent damage. Most people will experience joint damage in any type of arthritis, but joint loss or joint function loss is very, very, very common in psoriatic arthritis in very developed people. My grandmother states that her symptoms are the worst when she is outside and it is raining or cold, and is better when she is inside and it's warm and sunny outside. She is what her doctor calls environmentally affected. Lastly, now that we have covered the common cause and the common symptoms of psoriatic arthritis, we will discuss the common treatments as shown to us by Bailey Ayres Clinical Rheumatology, a book that I studied many journals throughout and read. There are three main pathways that people will take for treatment of psoriatic arthritis. The main one for people who are experiencing the early stages of psoriatic arthritis are the use of remittive agents such as methotrexate. These remittive agents help with the slowing down of the progression of joint damage and the disease itself. Other people who are later in their stages or who don't work well with these remittive agents will use things such as anti-inflammatory non-steroidal drugs. These are more for therapy usage for people who are later in their disease, or they will use more toxic ways to deal with their disease, such as cyclosporin A or retinoids. Cyclosporin A is a heavy immunodepressant drug, and retinoids allow for the decrease in cell growth. The regulation of the cell growth by retinoids allows for the psoriasis to calm itself, which can also help with the digression of the development of psoriatic arthritis, because as psoriasis develops further in the genome of the person or the DNA, they begin to see more of a connection between the development of psoriatic arthritis when psoriasis develops further on. And now that we have discussed all of the causes, symptoms, and treatments, we know how painful of a disease it is that affects a very moderate sized population in the United States. The causes, symptoms, and treatments of this disease relate all back to one thing: the patient. If the patient is very progressed in their disease and seek medical attention later on, their treatment and their symptoms may be different from someone who went and sought help before they had progressed greatly into this disease. Some of you may know someone who has been diagnosed with arthritis or even has psoriatic arthritis. I know my grandmother and my microbiology teacher, as I just found out a couple of days ago, have both been diagnosed with psoriatic arthritis. My grandmother found out later in her life that she was diagnosed with psoriasis that led to the onset of psoriatic arthritis, whereas my microbiology teacher, she found out early, very early, and was able to slow down the progression. And they both experience this pain in different places. My grandmother feels it more in her hands, whereas my microbiology teacher feels it more in her neck. And they both feel these pain levels in totally different ways. My microbiology teacher will feel it more when she hasn't taken her meds, whereas my grandmother will feel it more if the weather's bad. People are different and they'll experience it in different ways. And many of these people who are diagnosed both came up to me and said, there are good days, there are bad days, and there are worse days that come with this disease. But none of that will stop them from trying to live their best life. They have come to the terms that they have this disease and that they are able to live with it. It may lead to a lessening of their lifespan or a more difficult time living a happy, healthy life. But they have come to the terms with the fact that they can live with this disease and that, yes, it may be painful, but there are treatment ways and there are ways to deal with it besides giving up. Thank you for listening to me.